My name's Jenny Phillip. I'm a palliative care doctor. So palliative care is an approach that is helpful for people with serious illness. It's about helping people live as fully and as well as possible, even in the face of serious illness. I work alongside, for example, the oncologists, and whilst I leave treatment of the cancer to them, my particular role is solving problems that a person might have that's being thrown up by their illness or what's happening for them at the time. So it's all about improving quality of life and improving living for as long as a person has. So a person with a serious illness can get different problems. They might be symptom problems. So for example, occasionally people get pain in the setting of cancer. It's not an uncommon problem, not universal, but not uncommon. Other symptoms also can be helped vastly using medications or interventions. So symptom control is a big part of what I do. We often also help support people in all the other parts of their life. So it might be that they need some extra information, and we spend a lot of time explaining to people around different treatment options. And we can also support people at home and to stay at home, even up until, for some people, if they wish to die at home, then that's an important outcome that we try and support as well. Sometimes people are concerned or shocked when the words palliative care are raised because they think that means they're going to die now and that there's nothing else to be done. And I very strongly try to explain to them what palliative care is about and explain not only the benefits in terms of them feeling better, but also the benefits in terms of them living better and living well and living for as long as they have. And this can be delivered alongside all their cancer treatments. So palliative care does not mean by any means necessarily the end of life. Palliative care just means high quality, good part of care. There's been some very interesting studies that have been published internationally. These studies have shown that when palliative care is delivered earlier, that there are benefits for people which seem to be over and above their usual care for cancer. And people not only feel better in that they have better pain control and better other symptoms and feel more supported, and their families feel more supported and more satisfied. For those people, when they do come towards the end of life, they seem to make different decisions. They seem to have a higher likelihood of dying at home. They seem to have a higher likelihood of electing to have treatments which reflect their values. And very interestingly, a number of the studies have shown that people who get early palliative care live longer. So palliative care seems to be doing a whole lot of things, and in addition to that, seems to help people to not only live better but live longer. So there is a belief in the community and indeed amongst a lot of healthcare professionals that palliative care is only for people at the very end of life, and some people would even think only in the last couple of days of life. In fact, new evidence that's emerging shows that palliative care, when delivered earlier, can give many benefits, and including survival benefits. So we really need to dispel this myth that palliative care is something that you only do when everything else is finished. In fact, people can have life-prolonging care and palliative care at the same time.